CAH, some of the protocols we do, some of the nutrients, kind of getting a little bit in depth on that.
Don't
And
forget
we'll
to
probably
share
be
your
having
screen.
more of that. And I will share my screen, thank you. So we'll continue to get better at this over time here. So I'm going to present. So the first thing is that we want to talk about what's been going on with the country in the last week or so, and you know, we really feel that this is a tragedy that's happening, or that has happened, and then also an opportunity to come closer together, to unite rather than divide, and we just want to acknowledge that. So if we could just take a deep breath, just closing our eyes and taking 3 deep breaths in and out, just to imagine a world with more peace, more love, and more connection, and we're realizing that we're all connected. Just taking a deep breath in and out with that in mind. And as Gandhi said, to have change, we have to be the change. So just taking a breath in and out. Feeling the change in your own body as the breath goes in and out, rise and fall of your lungs. And what you can do to contribute to unity, to building a better world, both for your community and in your own life as well. Thank you. We have a polling question today, which is Laura's at town hall here. Have you had IV nutrition therapy before? So this could be something like IV iron. It could be fluids, but it could also be micronutrients, things like vitamin C, glutathione, which we'll talk about a little bit later, or some of the other more specialized nutrients that we do through the IV nutrition therapy program. So if you could please vote on that, or just give a feedback on that if you've had it before, so we can kind of see with the group today. Be really appreciating that. So a fair number, about a third, a little over a third, have had IV nutrition therapy. And for those that have, the 9 people that have today, we'd love to hear your thoughts on, if you've had it here at CAH, we'd love to hear you. You know, if you have had some, you know, results from that, and how's it been going for you? If you're wanting to share, and no pressure, but if you would like to, you know, that would be great, just to kind of share with the community of how your experience has been. And for those that haven't, we invite you to listen in today, and thank you so much for listening in. We'll kind of talk a little bit more in depth about that. If you're interested, we can tell you how to do that. I think Meg is on as well. She's our second IV nurse, and she's also a nutrition student at MUH. So welcome, Meg, to the town hall.
Hey guys,
officially.
can you
Hi.
hear me?
Yes, you can start your video if you have it. There you go.
There we go. Hey guys.
Good to
How's
see
everyone?
you, Meg. Good. How are you?
Good. I'm great. Just
You're
in the IV room right now.
You're in the IV room. Nice.
I am, yes.
All right.
Probably
great.
should have this above my nose.
You're in there by yourself, I guess, probably.
There is a patient in here.
Okay, got it. Okay.
Mm-hmm.
So another thing before we start with IVs is that we do want to just let you know that if you're on Facebook, we have a CIH Tribe Facebook group, which is a community page. It's free to join. You just have to request to join. You can get additional access to some content that we have exclusive there, sharing health tips with community members here at CIH, but also around the world. We have a worldwide group now of almost 500 people, meeting like-minded, health-oriented, and wellness-oriented individuals who are very passionate about advancing their own health, individual health, and community health as well. So please join us there, and here's the link here on the wall here. That it's a fun time. So some quick updates on COVID-19 in the office. This was kind of from before. One thing that is increasingly clear to me is that hydroxychloroquine is not necessarily the cure-all that it was kind of meant to, possibly meant to be. I think there was a trial that just preliminary results from yesterday actually is not on here, but it's called the U study from Minnesota, and it showed that hydroxychloroquine was not effective in prevention of COVID. So that's becoming less and less of a an option, although I wouldn't rule out that it would help some people. It's not like an absolute, but there's another trial that showed a negative result there. Please continue social distancing as we move into potentially very soon level 2 for Montgomery County. Social distancing still, please be safe, you know, when you're shopping, when you're out at restaurants and things like that. There's a lot of research still being done on vaccines and drugs, and so we'll keep on, you know, talking about that. NIH is doing some trials, and WHO is also doing trials. And I think what we wanted to say today to emphasize that coronavirus seems to be here for a while, so we want to optimize our lifestyle. We want to optimize our nutrition. We want to optimize our movement and really take care of our mind, body, spirit. And you know, and we can talk today also about how to optimize your micronutrient status to help your immune system, because that's going to play a much larger role in determining and influencing in a very profound way the state of your health and wellness. And as we know that COVID-19 is, from a functional medicine perspective, not only a virus and not only a lung issue, because there's no proven prevention or treatment. We know that it's actually a disorder of systemic acute inflammation that affects different organs, that affects different aspects of physiology, including blood clot, including increased or uncontrolled inflammation, and even the immune system attacking your own body. So we want to ensure both immune system, what we call strength, and also immune system tolerance to avoid this acute inflammatory response syndrome. And we're going to talk today about how nutrients can do that as some of the keys to maintaining and optimizing the immune system. So we have a group class, a virtual class of, how many of you, if you want to chat in here, it'd be interesting, have done this? How many haven't done this course, this class yet? If you want to chat about it, you can contact Gina to express interest in this. It's going to be Tuesday, June 16th. This is a class on a group visit that's built to insurance on how to optimize your immune health. So we'll talk about micronutrients a bit more there, and also things like T cells, natural killer cells, lifestyle, and ways to help with immune system strength and balance. So please let us know if you're interested in that. You can contact Gina through the portal to express interest in a third version of that class, which should also, and people that have taken it before are allowed to take it again. We're gonna add some things in there this time about acupuncture and yoga and sauna and different things to help hormesis, which is a way to stress out your system without overstressing it out to make your immune system more flexible. And then in June, we're planning to have a gut health virtual group class. Katie and I will be planning that hopefully in June, if not June, July, but we're gonna try to plan that soon. And I think we're going to introduce Laura here. I think a lot of you, at least a fair number of you know Laura. Laura is a registered nurse. She has a Bachelor of Science in Nursing. She's also a certified nutrition specialist and a licensed dietitian nutritionist. I think I got that right. And so she's our head IV nutrition nurse, and she graduated from MUIH with a master's in human clinical nutrition, and is basically, and then is also getting certified through the International IV Nutrition Therapy Group. So this is Laura here. You see her here as well as on the screen here. And then Meg is our second IV nurse, and we're so glad to have Meg on the team as well. And Meg is similar to Laura in terms of having in a lot of ways, personality-wise as well as educational-wise. She's also a current student at MUIH, Maryland University for Integrative Health for Nutrition. And with Laura, we've been able to start 4 days a week for IV therapy, more like 4.5 days a week, depending on the day. Sometimes we have every other Friday, every other Thursday. And we're going to talk about that slide. That part was for today. We're going to talk about today that IV nutrition is a way to boost the immune system. And we can contact Gina to schedule IV therapy with Meg or with Laura. And we can talk about how to do that at the end of this here. This is just a slide from last time. Nothing has changed too much on here. We're open now. Our labs are open. Nutrition is open via telehealth with Katie and Jen. The medical side is open. Dr. D is on Wednesdays, Marna's on Tuesdays, and I'm here most days. And then Liz and Corey are now open for acupuncture. Carrie is not yet open, but she's working towards that. And I think some of the other practitioners, Dr. Keats, Dr. Davis, and Gilman are on telehealth. Dr. Hees is doing telehealth via physical therapy, which has been great for patients. And Nick has just started today with the brain mapping and brain scanning. And Tony just started today as well. So welcome, Tony, if you're on here. Health coaching with Tony just started today as well. So this is great. And we are accepting new patients. Again, the number to call is that number right there, 301-602-2372, which is Gina Washington, who's our new patient coordinator, or you can go to the website to learn more about us or about some of the newer services that we have. We're going to be updating that. And I'm going to give it over to Laura here. So welcome, Laura.
Should I share my screen so I can change the slide?
Yes, so I'm going to
Okay.
stop sharing and
Okay.
then I
Let
can.
me share.
Yeah.
Oh man, I went through this last time. All right, I think I do this. Sorry, I am not the most technologically savvy here. All right, did that work? Can you see my slides?
If someone could chat in there to let Laura know that you're seeing the slides.
We can see them. It's good.
Okay.
Good. Thanks, Jen. Sorry, I can be a good nurse, but I'm not so sure I am a technologist here with the computers. Anyway, hello, everybody. I'm happy to be here and happy to have Meg here also, that she was able to pop in while she was taking care of her patients. So let's talk a little bit about IV nutrition therapy. Oh, not changing. Hold on. There we go. So why would we do IV nutrition therapy? One of the main reasons, and I think a lot of our patients are experiencing this, is poor digestion and challenges with our gut health. So if you have any sort of digestive challenges, then you might not be absorbing your nutrients from food as well as from your supplements. Whereas IV nutrition is 100% bioavailable. So one of the pharmacies that we order some of our nutrients from had this chart, and I just extracted some of the nutrients that we use, excuse me, that we use in the clinic. But for instance, glutathione from food sources is negligible. The liposomal form, you're going to absorb more, but the pharmacy didn't have exact percentages on that. But as an IV, it's almost 100% bioavailable. Same thing with B12. When you take a B12 supplement, you only absorb about 25% of it, and that's assuming you have good gut health. And with IVs, it's going to be 100% bioavailable. Vitamin C, about 50% at dosages less than 1 gram. And we give much higher the dosages than that in the, as an IV, and I'll go into that in more detail, but it'll be 100% bioavailable. You're sensing a theme here, right? Magnesium, only 40 to 60%, or anywhere between 15 and 60%, depending on the dose. And zinc, only 10% when you take it orally. So that's one main reason that it's great to take these things or to come in and get them as an IV, because it is guaranteed bioavailability. So this is just a list of the current nutrients we have. There's a very, very long list of things that we can order and that we may start incorporating into our protocols as we move forward. Right now, we offer magnesium, methylcobalamin, or B12, and a B complex with these various B vitamins in it, ascorbic acid, also known as vitamin C, glutathione, phosphatidylcholine, NAD. We do chelation with EDTA, iron, and then we also just recently added zinc, but I forgot to put that on the slide because it's a pretty new one that we've just been able to get from pharmacies again. And we use all of these in different nutrient combinations. So I'm not going to go over each and every one of those nutrients separately. I just kind of wanted to touch on a couple of the big ones. So glutathione is one really important nutrient that is a master antioxidant in our system. So anybody who's struggling with any sort of chronic issues or chronic disease, or perhaps doesn't have the most optimal diet or any of those things, can have what's called a pro-oxidative state, where you're releasing a lot of oxidants that can be damaging to your cells and to your system. So glutathione, along with vitamin C and vitamin E and some others, is sort of the master antioxidant. And Dr. Wong, who is much better at the analogies than I am, he compared it to a general in an army versus the soldiers who are there to protect the general. So vitamin C and E are sort of the frontline antioxidants, but glutathione is like the orchestrator and the master of them all. So inside the cell, there's really high concentrations of glutathione. And when those levels decrease, the cell dies. So you really want your cells to be thriving and alive unless they have a reason to die off. And that is part of the process as well. Mitochondria, if anybody remembers from biology class in high school or middle school, these are your energy powerhouses inside your cell, like little organelles. And they are really susceptible to glutathione depletion because they produce a lot of oxidants. So as you can imagine, any situation in your health that would create a lot of oxidative stress is going to deplete glutathione. And as we mentioned before, food sources aren't particularly effective at increasing these plasma levels. So the main way that we get it through diet is by providing the building blocks, because your body can make glutathione on its own. So specifically sulfur-containing foods like mushrooms, onions, garlic, those kinds of things are going to help give the building blocks for glutathione. But if there's any process in your body where you have a hard time synthesizing it, then you might not be so successful at raising those plasma levels. But glutathione as a whole molecule in foods really is poorly absorbed. So it's hard to raise your plasma levels by eating glutathione in itself. And then here's a list. There are a lot of things associated with glutathione depletion. And I just went through a webinar a few months ago, actually, and they did an entire lecture on glutathione for an hour and a half. And it was pages of slides on different conditions associated with deficiency in glutathione. And I just picked out some of the main ones that most of our patients are experiencing. Diabetes, any sort of GI inflammation, lung function, that's a really big one for lung health, glutathione. If you have any asthma or COPD or anything like that, glutathione can be really beneficial for that. And it's also really beneficial for any disturbances in the central nervous system like Parkinson's, ALS, multiple sclerosis, Alzheimer's. Chronic fatigue is another one. So there's a lot of things. Glutathione plays a lot of roles in our body. And we do give it in the office as a separate bag. So just like it's very reactive in your body, it's also very reactive in the bags of nutrients that we mix. So we keep it alone. It doesn't get mixed with anything else, and it's given in a small bag, and it only takes about 5 to 10 minutes. And we give it with almost all of our protocols except for the high dose vitamin C. And I can explain why as we get a little further on. And then let's talk a little bit about ascorbic acid for a minute. This is the other big one that I'm going to touch on. So vitamin C, another antioxidant, and at low doses, when you take it under, say, 12 grams, which is a pretty high oral dose. A lot of people wouldn't be able to tolerate 12 grams of oral vitamin C because it tends to cause loose stools. But we can achieve higher plasma levels with IV because we bypass that digestive function. So not only can oral C be metabolized by the gut bacteria before it gets into your system, but it's also affected by your ability to absorb it. So I don't know if I need to go into too much detail with this slide, but one thing that's really interesting is that with oral doses of vitamin C, you can get into the, I was getting myself confused there for a second. Oral dosing, you can get into the micromolar range, which is very, very, very small. And it's impossible to get any much higher than 60 to 100 micromoles in your plasma. But when you give IV dosing, you can magnify that by more than 1,000 times. So micro to milli is times 1,000, and then we're getting up into the 20 millimolar range easily with plasma vitamin C. And it functions in different ways at low doses versus high doses. So that sort of depends on what protocol we would order for you. So at any time above 15 grams, it becomes what's called a pro-oxidant. We talked a little bit about that before, but there are some beneficial pro-oxidative states. So for instance, your mitochondria are very pro-oxidant, and that's a good thing. That's how the mitochondria work to produce energy. And it's having a more oxidative state can be helpful, or I guess more targeted oxidative state. Let's say that, not a generalized oxidative stress, but very targeted pro-oxidant with the vitamin C can help with anti-tumor activity. It can help boost your immune system, and it helps a lot with may help with chronic viral treatments like Lyme and Epstein-Barr. And that's what I see mostly coming through our practice is a lot of chronic viral issues that we're working on with the high doses of C. So the protocols that we have, we do what's called an Immunoboost, and there's sort of different variations of our Immunoboost. It can range anywhere from 2 to 50 grams of vitamin C. We can go higher. Some practices go even up to 100 grams of vitamin C. We haven't really done that much at our practice. I guess we haven't seen the need for it just yet, but I'm sure if a patient comes along, we often do customize. And I should say, we do customize these protocols a lot for patients. Most patients who come through are going to start with our very basic Immunoboost, which is where you get 2 grams of vitamin C, and then you get all these other nutrients added to the bag as well. And with the lower doses of C, you'll also get the glutathione. But we will customize it depending on the patient and how you react to it. So most patients who come in for the Immunoboost, either it's their first treatment and we're just assessing tolerance, but it's also a lot of patients come in just for general immune system support. And I've certainly been seeing that a lot with this coronavirus. that's been going or caught our attention, obviously. So people are very concerned about boosting their immune system, and we should be. We should be really focused on it, not just now, but throughout our lives. Our immune system is our defense against the world. So the other reason, so let's see, we said support the immune system during an acute infection. So another reason people will come in is that they are having a little cough or a cold, and this was before coronavirus, because unfortunately right now, if you have an acute infection, we aren't able to support you in the office because we're making sure that other patients aren't affected. That's why it's good to come in before you have any symptoms. It's also good for any patients who might not be able to receive high dose vitamin C so we can help them with their chronic viral infections with lower doses. And it can also be possible for symptom relief during chemotherapy, because chemotherapy, and Meg might be able to speak to this more than me because she was an oncology nurse prior to coming here, but chemotherapy is very depleting. So being able to replenish some of those nutrients can be really helpful in symptom relief. Definitely needs to be something that's in coordination with an oncologist. Basically, it takes 30 to 60 minutes depending on how much vitamin C we're giving you and how well a patient will tolerate it. We give 2 bags for the most part, unless it's higher doses of C, and I kind of talked about what's in those bags. So we start with the glutathione, and then we give sort of this multivitamin mixture as the second bag. High dose vitamin C usually takes a little longer, obviously, because there are higher doses, and we give that over 40 to 90 minutes. And we don't give the glutathione because, if you remember, that the glutathione is an antioxidant and high dose vitamin C is a pro-oxidant, so we don't really want them counteracting each other in your system. And then just a couple more nutrients to talk about, just a few more to go through. One was phosphatidylcholine. So you might be familiar with sunflower lecithin and soy lecithin. So phosphatidylcholine is found in lecithin, and it is a phospholipid. So if you, again, I'm going back to your biology class from middle school or high school, maybe college or further on, but our cells have these membranes around them. You might remember they have a little ball and these little tails on the end, and those are the phospholipids. And that membrane is so important to making sure that what belongs in the cell stays in the cell, and what belongs outside the cell stays outside the cell. So if there's any breakdown in that membrane, things start flowing in that aren't supposed to be there, and things start flowing out that are supposed to be in there to make the cell work properly. So if we can really improve the health of that cell membrane, then it helps to make sure that things stay where they're supposed to be so the cell can function as best as it can. And this includes the membranes around those mitochondria that we were talking about. So remember, the mitochondria are where you produce all of your energy in the cell. You produce your ATP. And if those membranes are not intact or not perfectly healthy, then you end up with the mitochondria not functioning as well. And you might feel a lot of fatigue or not have as much energy as you want to get through your day or to exercise, things like that. Another really important thing about phosphatidylcholine is that it is a precursor to your neurotransmitter acetylcholine. So it also plays a big role in your ability for your nervous system to function. So that includes your brain health and your nerves themselves, musculoskeletal health, all of that. And lastly, this is why I love phosphatidylcholine. It does so many things. It's also an emulsifier, so it can help with lipid profiles. So if you are having any trouble with your cholesterol or things like that, it helps to emulsify those lipids so your body can eliminate them more efficiently. And I didn't put it on this slide, but it also really benefits liver health. So if you're having a lot of us in myself included, and a lot of us, our livers struggle because we live in a world that is fairly toxic. So we put a lot of stress onto our livers. So anything we can do to support our livers is really, really useful. So phosphatidylcholine can do that. Oh, there it is, put it there. So I think I actually touched on most of these. We also use it for mold toxicity, brain injuries, not so much in our practice. We don't see a lot of brain injuries, but I'm sure we're open to it. Yeah, I talked about most of these. We don't see pediatrics as much to help with autism, but it's a possibility maybe. And let's see, so with glutathione, you're generally in the office for about an hour, maybe a little bit more. And we do give a series of 3 bags. So you'll get the glutathione, and then you would get a dose of, actually we do this in the opposite order. It doesn't really matter which order you give it, but usually we give the phosphatidylcholine first, and then the glutathione, and then you'll get that Immunoboost with the 2 grams of C and all these other nutrients to help to support those processes. just like everything else, I haven't talked much about patient tolerance, but for the most part, these treatments are very well tolerated. I don't see a lot of side effects. Primarily, I see sometimes patients feel a little bit nauseous, and usually that's from administering it a little too fast for your own system. So we just slow the infusion down, and usually it's tolerated much better. So overall, it's about an hour in the office. And I'm just going to touch briefly on EDTA because this is a little bit more of a specialized protocol that we do for patients who have tested high in lead levels. So it does not chelate mercury, so I want to make sure that patients are clear on that. It only is for lead. And one thing that's very important is that EDTA will also chelate minerals that are essential to your own function, so things like zinc and selenium. So we will make sure that you're supplementing orally with those minerals, and we retest those levels every 2 treatments to make sure that we're not depleting you of the essential nutrients that you need while we're trying to get rid of the lead that might be affecting some of your body systems. And it's very similar to our other protocols. You get the glutathione first, and then the EDTA, and then that Immunoboost we've been talking about with the 2 grams of vitamin C and all the other great nutrients. This one is usually 10 weekly treatments. And then we retest blood levels at the end. And last but not least, this is a new one that we started. It's pretty new to most practices. There are a handful of practices around the country that have been doing this for a few years, but for most practices, this is fairly new. NAD+ is an enzyme that's found in your body, and if anybody took biochemistry, you'll remember hearing about NAD all the time. It basically is an electron transporter throughout all of these biochemical pathways. And it is a really major player in all of your energy production pathways. So utilizing glucose, how we convert fats and proteins into energy when we are depleted in glucose, it plays a role in all of those. So these are the main indications that we use glutathione for. So chronic fatigue, anyone who just has that heavy fatigue that they can't shake and nothing else has really worked. NAD has been a game changer for some people. Mitochondrial dysfunction, same thing. NAD is a big player in your mitochondrial function. And while we aren't doing this at our practice currently, in other practices, it is used really successfully with addiction treatment. And it's a very big time commitment to do it for that. I think it's 10 straight days of 8-hour infusions. So that's why we're not really at a capacity to do that at our clinic currently, but it is out there. And then anti-aging. So that's another thing. You might find it at some of these more boutique clinics as well, but we have, those are some of the indications that you use it for. It is a long infusion. It generally takes 1 to 8 hours, depending on how high the dose is. We usually start with a low dose of about 125 milligrams. The 1,000 milligram dose would take a full 8 hours probably to get in. 125 we can do in about an hour. And we generally do 125 to 250. And depending on the patient, NAD is a derivative of niacin. So it can, if you've ever heard of the niacin flush, when people take high dose niacin for cholesterol treatments, it can cause that sort of flushing symptom. So it's nothing life-threatening. It's just a matter of having to slow the infusion down. But the biggest thing I've noticed is nausea when it's going too fast. So we just slow the infusion down and take it nice and slow. We got some nice pumps to help us with that process, so it's really helpful. And then the last thing, Dr. Wong touched on the coronavirus, but I just want to make sure everyone's aware that because, I understand some concern about IV treatments at this time because you're going to be in the room for a longer period of time. And for anybody who ever walked by my IV room prior to the coronavirus, we were very full. We had 5 patients at a time, people in and out all the time. And it's a great environment, and I look forward to getting back to that because the patients really get to know each other and talk to each other and learn from each other. But right now, we have 1 patient in the room at any given time. And I have been using a couple of the other provider rooms when they're not there, so we're able to see more patients. So, but nobody is in the same room at the same time other than the nurse and the patient. The provider and the patient wear masks the whole time, and all chairs, pillows, equipment, poles, pumps, everything is wiped down between each patient. We have an air filter running, and we pre-screen everybody the day before the appointment and again when they get to the office with vital signs and such. So we're doing everything we can to keep everybody safe and healthy during this time. And I think that's it on my part. So I will stop sharing and go back to Dr. Wong.
Thank you very much. Should start calling you Professor Parkins.
Oh my gosh.
Great.
I hope it was
Biochemistry
okay.
and biology,
Yeah.
and you know, this has been, you know, we've been doing IVs now for 2 years, although Laura's been with us for about a year now, I think, almost about a year. Is that right?
Yeah, I've been there, yeah, a year in July 1st.
In July, yes. Okay, so very, very soon. But you know, this has been an amazing, you know, journey to see how IV therapy can really accelerate people's healing. You know, I think treatments that might take, you know, longer, like we said in the conference, like 12 months, it might take them 4 or 5 months to get better from things, because people need nutrients to heal, and we are what we absorb. So essentially, if we're taking nutrients in but they're not absorbing them because of gut issues and things, then we're gonna need IV to help with getting it right to the cell. It's almost like you're on, you know, if anyone knows 270 in Maryland, you're stuck on 270, you gotta get on the off ramp so you can go on I don't know, 29 or something, you know, so you can, or some other, you know, some other road, so it's not blocked. So it's really kind of bypassing some of the roadblocks that we might sometimes see with either cell membrane health or with gut health. And so yeah, do you know, Dr. Applebaum asked which air filter are we using in the IV room?
I honestly can't remember. It was one that we had in the office already, so we didn't buy anything
Maybe
industrial.
Meg,
So,
maybe Meg, if you're in the IV room.
Yes,
You could,
it's a Levoit. I believe it does have a HEPA filter in it, but it's a Levoit brand.
great, thank you.
I don't know if that answers the question.
Okay, we'll yeah, if you have another follow-up question on that, just please ask. Thank you for the question, Dr. Applebaum. Regine asked about, is the treatment covered by insurance? We submit everything through insurance, and we have a specialized person here, a staff member at CIH now named Wendell, who is actually offsite, but he's basically checking everyone's insurance, you know, to look at coverage of that. But we submit codes via insurance now, which we didn't do before. So you know, we're submitting all these IV treatments to insurance, and it seems to be working. So I think it's really great. We might be the only practice in DC that actually has IV nutrition on insurance, and that's one of their commitments to, you know, increase access to this type of treatment, because we know how beneficial it can be for patients. So thank you for that question, Regine. And you know, there's certain ones that are definitely, you know, it depends on the diagnosis and things, but in general, we're okay with that. Leslie, you want to start with that, and then maybe I'll start too. Leslie has a question. How does someone know if he or she needs IV therapy of blood work or symptoms? Any thoughts on that, Laura? And I can chime in as well.
Well, I would say if you know you have digestive issues, that is probably a really good place to start, because if you, so it can go both ways actually. Blood work and symptoms, I say, and it's very individualized. It's hard to answer those questions really specifically, because I think one of the things we do best at CIH is that we really look uniquely at each patient. So we don't have a lot of big protocols that we throw at everybody. Everybody is different. So you might be working with your provider who notices that you have high Lyme titers, or positive for chronic Epstein-Barr, or any of those things, mold toxicity, and they'll work with your provider to know that IV therapy might be beneficial to help with some of those. If you have any signs of nutrient deficiencies, so if you're working with Katie or Jen and you know, who knows, you have some tingling in your fingers that signifies a potential B12 deficiency, then it might be beneficial to come in and get some B12. If you have a B12 deficiency, you might have widespread deficiencies as well. So I think working with a provider is probably the best way to go, unless you are interested in just doing immune support. And you might find that when you come in, I have seen some pretty amazing responses from just the Immunoboost, the very small doses. I have some patients who come in and they leave immediately feeling great. I had one patient, she's the next time I saw her, she's like, I feel like I woke up for the first time. So, you know, her body really needed those nutrients. And so it's very unique. It's hard to answer that question because I think it's very individualized.
Yeah, it is individualized. I think definitely working with your practitioner, taking good history, doing a physical, doing the lab work. You know, there are some vitamin tests that we can check, and there's certain specialized vitamin tests that we can look at that compare what's called extracellular nutritional status. That means what is the level of nutrients outside the cell in the bloodstream, which is typically what you would check on LabCorp. or you know, more conventional lab, but we also have these tests that will compare this outside the cell level of nutrition, which is extracellular nutrition, to what is called intracellular nutrition, which is the level of nutrients like vitamin C or glutathione or cysteine or magnesium or whatnot inside the cell. So you can actually see how the membrane's working by comparing those levels of nutrients outside versus inside the cell. So blood work can be very helpful, but it doesn't tell the whole story, because sometimes we use IVs also as a pathway to accelerate healing. If someone has normal levels in the bloodstream, but then they're not getting better, they might not have optimal levels of nutrients for them to overcome their gut issues or overcome their fatigue issues or overcome their immune system issues. And so sometimes we need higher doses of vitamins that we monitor, you know, with clinically to see if that is better. And I think symptoms is a big driver too, like how someone's feeling. You know, if they're feeling better on it, it's likely that, you know, the body is the most wisest, you know, doctor, you know, sort of in terms of, you know, practitioner is your own body really is going to tell you if it's going to be helpful. But we do use blood work, I think, to guide it a little bit, and then also our clinical status. And Laura and Meg would, you know, assess you on every visit too.
Yeah. A couple of things that came to mind as you were talking. One is this idea of intracellular versus extracellular. One of the other benefits of IV nutrition is because you increase that plasma level, it pushes nutrients into the cell that might not otherwise get in there. Because if you, again, I'm going back to these biology classes and biochemistry classes, it's an osmotic difference. So when you have a higher concentration of something outside, you tend to force it inside, or it gets transported in because the concentration gradients are different. So that's one of the benefits. And then also in terms of individuality, when I was talking, you know, I do have some patients who respond immediately to this, but that's not the case for everyone. Some people, it does take several treatments before they start to notice the difference, and it's a more gradual change. So I don't want to set anybody up for expectations that they're going to come in and this is life-changing for everybody immediately. I wouldn't say it's an immediate thing for everybody, but it is definitely for a handful. I hear it. I hear some people.
It's every handful life-changing. For the majority, it is beneficial over time.
Right.
And I think that someone, let's see, I think it was, someone had a question. Sorry, I'm trying to look at the chat here. Who was it? Had a question about the treatment protocols and whether or not you need to do it just once or you know, by you know, serially. And I think we generally try to do I think testify, thank you, once a week for about 10 weeks, and we reassess midway through. We reassess at the end of that, see how you're doing, check some lab work, check some safety labs. You know, I kind of think it's an ongoing type of treatment for that 10-week period, and then seeing how you're doing with that.
And your nurse assesses you at every treatment.
Every treatment, right.
Every single
exactly.
treatment. You get assessed by the nurse to know whether, so I think Testify also had the question about whether it's one recipe for all. So just bouncing, sorry to interrupt you, Dr. Wong, but to
no, that's fine. This is a good tag team, yeah.
Okay, good. But yeah, it is not one recipe for all. So I have plenty of patients who come in and we assess every single appointment to say, that I felt really, especially for patients who might have multiple chemical sensitivities, they tend to be more sensitive to these nutrients and say, I didn't feel that great after the last nutrient or last infusion. Okay, let's change it up a little bit so we can make sure.
Yes, and since I see Dave in here, hey David and Nancy, I'm going to throw some jokes since I know he's in here and do some jokes. So this is not cookbook medicine. This is really gourmet, you know, chef healing. I think is what I would say IV therapy is. And the other thing that Laura mentioned, which I think is great as an analogy, is there's some rides in the water parks called lazy rivers. So you can like literally, you know, sit your butt in like a plastic tube and it just kind of flows really passively, and you just flow in a circle, and it's just like a fun ride. But anyway, if anyone ever goes to that, it's near Bethany Beach. But basically, what IVs is doing is pushing you. It's giving you a little push. You know, that the river is just, you know, like pushing a little bit more, and it's pushing those nutrients into the cell by creating that osmotic gradient that Laura was talking about. So the nutrients get into the cell, you feel better because your mitochondria have more nutrients and the cell membranes have more nutrients. So I think that was a attempt at humor, biology humor. Anyway,
like
about the lazy river. If anyone got that, just let me know if it made sense or not. I think Mustafa also asked about Amber has taken 2 treatments out of 10 for Epstein-Barr and stopped 3 months ago. Does she have to start all over again? No, I don't think you have to start all over again. There's the research that was done by the clinic in Kansas called the Raritan Clinic by Dr. Mikarova in 2014, which basically showed that if you take the Epstein-Barr treatments, you stop it, but you continue it, then you can reduce the levels of early antigen antibodies by about 40%, and people feel better, they feel less fatigue. So that's, I think it's cumulative, you know, over time. I mean, of course, it's better to try to continue and not have a huge break, but, you know, there was COVID and all this stuff, but I think you can restart it, and then you can just reassess the end of the 10 total is what I'm thinking.
I had a question here. Do I create the recipe for a patient, or would the practitioner prescribe a certain combination? So I would say it's a collaborative effort, because the prescriber puts in as a nurse, I'm not allowed to order these things separately or independently. So the provider puts in the order, but because I am the one at the bedside with the patient more often than not, I will go back to the provider and we will work together to maybe change the orders or change the cocktail that we order. So yeah, it's a collaborative effort for sure.
Thank you. And I think Maria's here. If Maria and Nisa had some comments about how it's helped them, I think that would be great if you don't mind calling in and just kind of chatting with people here in community. If you have that, Nisa, and then we have some questions too. Let me get Nisa on the line, and then we'll get to Andre and Jackie. Thank you for calling in. And then if I think Maria also, if you could chat if you'd like to about it. Thank you for the comments. All right, so I think Nisa's on. Hey, Nisa.
Hi.
Nisa.
Hey.
I have just the highest praise for Laura and Meg, and of course you as well, Dr. Wong. But I have been doing the Immunoboost and the NAD treatments. I did it pre-COVID, and I was feeling so much better. And then over the 2 months where I couldn't come in, my energy declined, and I've been able to come back, and I'm building up again. So I have the highest appreciation for both of the cocktails that I've been getting. And just an additional comment before I joined this practice about a year ago. The prior practice was charging $600 plus an office visit for the NAD. So the fact that you can do this through insurance, you know, great. And if I had to pay some amount for the out-of-pocket, then I'd be glad to. But y'all are being not only so medically responsible, but also so financially kind. So thank you.
We're so glad that it's helping you, Nisa. Thank you.
Thanks,
for that
Nisa.
comment. Let's see. So I think, let me see if there's Jackie. Let's see. Hey, Jackie. Jackie, are you there? Let me see if we can.
Unmute. There you go.
There you go. Hey.
We've been taking full script multivitamins for about 3.5 years, something like that, since we've been coming to you. And I thought that was helping with the glutathione. Would the infusions be different, or would this be, in other words, taking the multivitamin supplements, does that sort of provide you with a good base, or does it still need an infusion?
Laura, do you want to?
Actually, if you wouldn't mind answering that, I have my daughter yelling at the bedroom.
Oh yeah, sure, no problem.
Sorry.
I'm in a quiet room here,
one of
so
those
in the office.
home issues, yes.
Oral can help, as Laura said. There's an absorption issue sometimes with glutathione, and the multivitamin doesn't have glutathione in it.
Okay, I thought something you prescribed it, and we've been taking all that. I couldn't remember.
Oh, I see. Yeah, I mean, I think it is somewhat effective, but certainly IV would be stronger. And so, depending on what's kind of going on with energy and immune system, it would be beneficial to check that out and to do some IVs. And I would say we would set you up with either Laura or Meg, depending on the schedule. Now that we have more kind of days available here, now that we have both Laura and Meg, I think we should be able to accommodate that for you guys.
Okay, thank you.
Thanks, Jackie. Thanks, Liz. And thank you. So I think
We had a
Jennifer,
oh, sorry, go ahead.
yeah, go ahead, go ahead.
We had a question up higher in the chat about
Okay.
SIBO and whether it
Oh,
treats
thank you,
SIBO.
yeah, there's a,
Yeah, I wouldn't say anything we're doing at the moment would treat SIBO, although there are some IV therapies that are on the horizon maybe for us that do affect the microbial environment of your gut, even if it's given through the IV, but we aren't currently offering it just yet. We have to work towards that. But I think it will augment, or perhaps augment maybe is not the right word, but coordinate with your current treatments, because when you have SIBO, obviously you have this lining of bacteria along your small intestine, and your small intestine is where you do all of your major micronutrient absorption to some in different locations in your small intestine. So if this bacteria has overgrown in there, it reduces the surface area where you're able to absorb those nutrients. So again, IV nutrition will bypass that. So I think at the moment, what we offer currently would definitely be beneficial in SIBO. And I have a lot of patients who come through with SIBO.
Yes, and I typed in the chat, I think for SIBO, a couple of considerations is that giving oral iron, which will then go get metabolized in the, down the stomach to the small intestine where it's absorbed, can feed SIBO. Like, having oral iron supplementation can actually feed SIBO. So if someone's iron is low, and we've had this a couple times here already, is that someone's iron is low, they have SIBO, they should probably get IV iron. That'll be one indication for IV nutrients for SIBO. And the other I was thinking of as you asked that question was phosphatidylcholine. It can also help to rebuild the gut lining and to help rebuild the cell membranes there. So that would also be another area.
Tagging onto the phosphatidylcholine, apparently if you do have SIBO, phosphatidylcholine might not be the best place to start. Not to say you can't take it when you have SIBO, but that IV might be more beneficial. I can go into more depth with you on that, Dr. Wong, later, but something we talked about this weekend when I was.
Great. Okay. Yeah. Love to learn more about that.
Yeah.
I think Joseph had a question about Blue Cross Blue Shield, and this goes against any insurance, is that just to emphasize, we do submit all IV treatments to insurance, and we have a dedicated specialist named Wendell that pre-checks all the codes for us to see, what's going to be covered or not. So I think generally we're submitting everything through insurance now, and yeah, I think it's working out fine. So I think that's been fine for the insurances from what I can tell. I think, let me make sure did we miss it? Is IV therapy most effective weekly or monthly? From Jennifer. It sort of depends on the person. What would you say, Laura, about that?
Very dependent on the person. So some patients, I have a few patients who come in every 3 weeks because they've been doing this long enough that they know that point is where they start to feel the effects, or they're trying to come in before they start to feel the loss of the effects, and they just know from their experience that is their benchmark. Some patients really need to come in weekly. I think initially, I think weekly is ideal, at least for the first month, to really establish a routine and to figure out how you individually respond to treatment and whether you're one of those quick responders or slow responders. And then generally from there, I start tapering patients down a little bit. So I have some patients who've been coming in weekly and they say, well, I want to see how it feels. So I say, all right, let's do 10 days. So instead of coming in every Monday, why don't you come in Monday this week and Thursday next week, and we'll see how you feel. And if your symptoms started coming back, let's go back to every Monday. If you still feel fine, let's try to spread it out to 2 weeks. And so I work very closely with the patients to determine, and the providers to determine what's appropriate.
Yeah, and even though it is individualized, it's still very systematic. Laura Meg is, constantly in conversation with the team, with the practitioners, and also with the doctors or whoever. And I think basically, we want to make it both individualized and systematic to see how you're doing, assess the patient, assess how they're doing, check lab work periodically depending on the IV, and then we have follow-up medical appointments as well. So I think with all that, it's a pretty systematic approach. Even when we're trying to tweak the protocols, we're pretty kind of doing that on a regular basis.
There's a question up here from Jennifer. Are blood labs required prior to IV therapy? And the answer is yes.
Yes.
Yeah, we screen everybody with basic blood labs, including a G6PD, which is an enzyme that's really important, especially when getting high-dose vitamin C, to know whether you're deficient in that particular enzyme. So yeah, everybody gets labs. Oftentimes I draw them Sorry, and I wouldn't draw them the first visit because we would need to have the results in there. But if we ever do repeat lab work, I can often draw them when you come in for an appointment, so you don't always have to be stuck twice. So we try to consolidate that process as much as possible also.
Okay, and then I think Maria's back. Welcome back, Maria. I think you can, Jen, I think, does she have to raise her hand, or isn't that how she does it?
She'll just have to unmute herself. I just allowed her to
Okay.
talk.
Can you hear me now?
Hey.
Yeah,
Oh,
hi Maria.
got it. Hey, Maria.
Hi everyone. I can truly say that the IV infusion, I had weekly over a long course of time, was just fantastic. I can't wait to start the treatment again. I have ulcerative colitis, and I've never been able to use vitamins alone to give me any energy. I always had quite a bit of fatigue and brain fog, and the infusions very much cleared everything up. I felt energized from the moment I left the office every time. After a period of time, Laura indicated that I could stop taking them weekly. I imagine that I'll be back to weekly when I can get back to the practice. I can't speak highly enough for not only the treatment, but the care and concern that you experience when you're going through the process.
Thanks, Maria.
Thanks so much, Laura. Thanks, Maria. Well, Laura and Meg both very caring, and they definitely know that they're so good at what they do and so caring as well. So thank you so much. Glad that you're feeling better. Yeah, I just want to emphasize something that Maria said too, is that as she gets better, once a week might become once every other week or once every month. So we really want to try to target what's called the minimal effective dose, which is just a term that I use in terms of how we use therapies in our practice in general, whether it's an oral therapy, whether it's a supplement, whether it's a medication, whether it's IV nutritional therapy. We want to provide you with, we want to kind of figure out what the minimal effective dose is so that you're not getting too little or too much, if that makes sense. So if people have questions about that, but I think it's very important to know that it's not like an inertia situation where we're just kind of
not at all
being a zombie, and the exact same treatment every week.
Very dynamic, very, very dynamic. I think like Dr. Wong and I are always communicating, or if it's Marna who's ordering or Dr. D, we're always communicating about how patients are doing. And also the minimal effective dose is interesting too, because we also don't just rush into high doses of vitamin C or high doses of any of these nutrients, because sometimes a very small dose is extremely effective for some people. So it's again, going back to the individuality of everybody.
Exactly. I would just add on the, let's see, there's a couple of things, but I would say people with cardiometabolic syndrome, I know you put that in slides, people that have cardiometabolic syndrome, their glutathione is going to be low, their vitamin C is going to be low. These are shown in studies. And so if you're trying to lose weight, if you're trying to have more energy, you need more energy inside your cells. And that's where the gut's usually off. There's some oxidative stress and inflammation. And as we said, C for Calvary and G for general, the vitamin C is protecting the glutathione from getting oxidized. But there's a battlefield out there, I guess, from a inside the body, so to speak. So there's what's called chronic inflammation, which is what we talk about in our virtual group classes on immune system health. Here is that there's chronic inflammation that can deplete these micronutrients. So you need more quote unquote water for the fire to neutralize the fire, to decrease chronic inflammation. So I think that's why doing some treatment like what I'd recommend typically for someone with diabetes or with weight issues or metabolic issues, fatigue, is starting with this once a week for 10 weeks program with Laura and Meg, and then systematically reassessing over time. Do you need once a week? Do you need once every other week? How are your labs? How are you feeling? Maybe you can go down on your medications, these type of things. And we've seen this, and this is why it really makes sense to understand the physiology like we're doing here to see who might be benefiting from this. So I think cardiometabolic is huge. Brain health, like Maria said, brain fog. Brain fog means that your membranes are not working. Your cell membranes are not working, they're inflamed. You need to have good information. Functional medicine, integrative health, whether it's from a lifestyle perspective, whether it's from a nutritional perspective, it's actually very simple. It's giving your body good stuff, giving your mind good stuff, getting your spirit good nourishment, whether it's physical nourishment like nutrients, like clean air, clean water, whether it's spiritual nourishment like affirmation, devotion, gratitude, love, joy. This is nourishment for your body, and then taking away bad stuff, you know, basically toxins, chronic stress, chronic inflammation, pollution, and, you know, unhelpful thoughts. Like this is what the practice of health and healing is putting in good stuff of all types, mind, body, spirit, and then kind of letting go of things that don't serve you. So I think that's where it's essentially the nutrients are going to help you. And I know that I'm getting off on a tangent here, so I tend to do that. But we use in our clinic physical wellness to advance emotional and spiritual wellness. So this is another piece of the puzzle here, is that we have to understand that this is a part of the whole picture of treatment. Like IV nutritional therapy is a part of a whole picture of what we do, because you still need to heal your gut if possible. You know, sometimes it's hard with ulcerative colitis and different things, but ideally you heal your gut, balance your hormones, help the detox, and IV nutritional therapy can help with all those things. That's what I would say.
Excellent. You had one last question.
Someone
here.
had a question or something, yeah.
Is this safe for kidney disease?
Janelle, chat. I think Janelle is on here.
Oh,
hey, Janelle.
sorry.
Let's see. I think, does she have to do something again? Sorry, Jen. Can you say that again?
Yep, so she'll just have to unmute herself now.
Okay, thanks. Just click on the unmute, which I think is in the little blue dot. While you're doing that, I think Julie asked also, is this safe for kidney disease? Laura, do you want to speak to that? Because I know we just had a conference about that.
Yeah, I mean, I think it definitely had to monitor fluid intake and things like that. So from a nursing standpoint, we would be more cautious with giving fluids. Yeah, I'm not sure actually how much to answer about that one, or how detailed I can answer that one.
Yeah, I mean, I think in terms of, so we're talking about, let's talk about first of all people without kidney disease. So the studies show that you need you could take up to 3 liters of normal saline, I believe, and be fine, and like throughout the day and stuff. So if someone had kidney disease and their excretion rate, or what's called the glomerular filtration rate, was lower, then you'd probably want to, you know, give you less fluid and things like that. But again, this is where we do check kidney function before coming in. I think it would be safe for, you know, someone with mild, mild reduction in kidney function. Someone with severe kidney function, I would be a little bit more cautious. You know, someone that already had lower extremity edema, like swelling in the legs, someone that was already having trouble with breathing and things like that, we try to avoid. I think the 3 things we try to avoid would be if someone had severe, like condition severity of, you know, in terms of kidney disease. Mild, I think, would be okay, or severe heart failure or severe liver failure or something like that. We'd probably try to avoid that more because the fluid balance might be off.
Fortunately, a lot of the fluid, the nutrients that we can give in small amounts of fluid too. So in terms of that, we can definitely be cautious and decrease the
So
amount
instead of giving
fluid.
like half a liter, you give like 100
yeah.
or 200.
So most patients who come through are fairly dehydrated. I've actually gotten to the point where I'm mixing things in as much fluid as I can for a lot of these patients because they are dehydrated. But obviously, that would not be appropriate for someone with, you know, pulmonary hypertension or any sort of kidney problems where they're not eliminating things properly. So again, that comes back to the customized and how we tailor things.
Yeah, that we would depend to some degree on the labs and the urine test and, you know, different things like that. I think for that we would check a urinalysis as well, as well as the blood work. Let's see, we're gonna try Janelle again, if possible. If you can also, if you're having trouble with that, Janelle, you can put your question in the chat box there. Yeah, no, Testify asked this. I think this was interesting. Insurance companies so far, knock on wood, you know, and you know, we do take insurance, so there is that push-pull from insurance, of course, and we're grateful that they're able to, you know, do this, you know, to help patients. So we are grateful to the insurance companies for that. We haven't seen a limit for how many IV treatments one can have. I don't know if they really know too much about IV therapy, honestly, from an insurance point of view, but they seem to be, you know, and we work with really great, you know, a billing company that knows about these codes that we can use so we can, you know, bill insurance and make it more affordable for you. So that's been super helpful this year. Thanks, Julie. Thanks for the comments. Thanks for the questions. Great question. Yeah, I mean, I think the other thing to know is that if someone had, I think this is probably worth mentioning. If someone had kidney stones, I think it's kind of controversial
Yeah.
in terms of should someone get high dose IV vitamin C with someone that has kidney stones? What have you learned
Specifically
about that?
oxalate stones.
Oxalates, yeah,
Yeah,
if they
I
had
think that
oxalate
would
kidney
be,
stones.
that has actually been on my, I haven't had anybody come through with kidney stone problems, but it's been on my research list, and it's like 1 million
And
pages long
yes,
at the moment. But that is something I keep meaning to research more on.
I don't think there's. I've asked different people that are experiencing this too, and I think there's not a consensus on it.
Yeah.
The theory is that if someone had a history of kidney stones, that the vitamin C could help precipitate calcium oxalates, and that could cause kidney stone. If someone had a history of calcium oxalate kidney stones, which is a type of kidney stone. But again, that could be where we again do a safety urinalysis, look to see if there's crystals in the urine, look at their levels of kidney function and things like that. So
I also think,
luckily we haven't.
I wonder sometimes too if the oral vitamin C has a very different effect on the calcium oxalate stones than IV vitamin C would have.
That's true, because it's not.
Calcium oxalate, anytime you have any sort of oxalate issues where you might have high oxalates throughout your body, it's often from, and vitamin C can exacerbate that, it's often from an underlying gut dysfunction where you're not metabolizing the oxalate properly and not metabolizing the vitamin C properly. So that's sort of my thinking on it. I
So
don't
it's
have
almost
an
like a
answer.
gut dysbiosis issue.
Yeah.
That actually makes sense, right? And there is a gut bacteria called oxalobacter that helps, as Laura was saying, to metabolize the oxalates. So getting back to the root cause of the kidney stones, it could be related to that as well. Thanks, Regine. Thanks, Testify. Thank you for the comments. I know some people have to leave now, so it's at 1 o'clock. We can continue to stay on and chat more about IVs and biochemistry and kind of do some fun discussions here. And anyone else has any more questions? I think that one thing that's kind of surprised me, and just kind of what I've been learning about IVs from seeing the results and people and coming to IVs kind of regularly, is that people do get better that we haven't been able through our regular integrative medicine and functional medicine type of interventions, haven't been able to move the needle on. They're finally starting to move the needle, which I think is pretty amazing there.
One of the things tagging along to that that's really important too is when you give things like NAD, which is definitely can help to boost chronic fatigue and things like that, it is still really important to keep addressing the underlying function, because it's not necessarily sustainable for everybody to keep getting NAD treatments for the rest of their lives to feel well. We still try as a practice and as a collaborative effort on parts of all the providers to figure out why you might have a deficiency in NAD or why that's not functioning as well. So we do everything sort of simultaneously. So we keep trying to get to the root cause. But I think getting the IVs and feeling better is so important and imperative to being able to do the work to get to that root cause and to help with that root cause. So it gives you that boost of like, okay, now I have the energy to be able to cook my own food, or that I didn't have before, or now my anxiety and depression has lifted. So now I feel like I can go for a walk and I can exercise, which then is a feedback mechanism. So it's all just it's really just a big picture thing that we're doing. And the IV is just a part of that.
Yeah, and since Dave and Nancy are strong, I'm going to throw some more analogies just for fun, just for jokes, is that, it's like riding a bike with the nail in the tire. So it's like, why is the tire pressure not, why can't I ride my bike even though I've been working out and my quads are built up, but I can't ride the bike. So IV therapy, what I've found is that it kind of removes the nail from the tire, repairs the tire so the pressure is higher so you can start pedaling, so you can actually start moving the needle on your health. Exactly. So that's kind of what I would think about. It's kind of like, getting your bike pumped up again a little bit. Yeah, so that's great. I think, so Margaret asked, so the process, if you're interested, is that if you already have a practitioner here, you can talk to them about IVs. The practitioners need to order the IVs to Laura and Meg, and so we'll put orders in the computer. But if you haven't had them in the last year, we would typically check a complete blood count and a complete metabolic panel. The metabolic panel includes electrolytes like sodium, potassium, chloride, and bicarb, and also things like kidney function, creatinine, BUN, blood sugar, and then there's calcium in there, things like that. And then we also check a G6PD at least one time to check to see if, although we could check it more than once now, I think here, but just to make sure that someone can tolerate high dose IV vitamin C. So I think those are kind of the three things we would check. If someone had kidney function issues, we'd probably check a urinalysis as well. So there's some other things that you can check. And then as Laura mentioned on the slides, if you're trying to chelate out heavy metals and using EDTA, then you want to check mineral levels like RBC, selenium, zinc, copper, magnesium, iron, every 2 weeks, basically, to just be on the safe side, because you can chelate out minerals. You want to replete the minerals if you're doing a chelation treatment. What else? I guess mold would be another thing. I mean, that's another kind of esoteric, topic, but mold seems to be another thing that we see too.
Yeah, definitely seeing some mold. Do a lot of phosphatidylcholine protocols with the mold patients.
Can you comment on the patients with chronic infection? I know there's a few comments on that. I know we see a fair amount of people with either Epstein-Barr or Lyme or different things.
Mm-hmm. What specifically?
I guess they're what of their. I guess Mustafa said one thing about Amber. I think what I was just going to say is that that's more of a journey rather than a quick fix thing. Like
for sure.
One of the people I wanted to mention, she's not here today, but she wanted us to say that she had fatigue and insomnia and depression, I believe, and then after the first treatment, she comes like every 3 or 4 weeks. I think what I'm talking about, for wellness, and she's able to sleep better, has more fatigue. So that's again determining like the minimal effective dose and just understanding that for her, like once a month is good enough now, and she's able to just kind of maintain wellness.
Yep. Yeah, I have a lot of patients. I have one patient who, when she started receiving the phosphatidylcholine, she's like, I feel like I'm 27 again. I just can't believe the energy that I have. So, and she's not 27. So,
yes,
yeah, it's just her cell membranes needed some love, I guess, or TLC. And yeah, in terms of the high dose, in terms of chronic viruses, it definitely is more of a journey. And sometimes it is a ramping up protocol. And we start at the 2 grams and we work our way up. And I find that sometimes with the chronic viral patients, they're also the more sensitive patients to the treatments. So it's a slower process of working our way up to the higher
they might
doses.
react and have detoxes off it, right?
Right. So detox reactions are not unheard of in this. Sometimes every once in a while after the first treatment, patients will feel a little bit under the weather, as with some of these other oral protocols that you might be placed on. And I think that can be more common with these viruses, because as we start to eliminate the virus fights back a little bit. But I find with those patients, it is a slow, gradual improvement. It's after about 5 or 6 treatments. They're like, yeah, you know what? I'm not napping as much as I used to, or I don't need to take 3 naps a day, or something along those lines.
Yes, it's also important to understand that if you're new to IV therapy, you should eat some protein or some food before you come within 2 hours of doing it. That's what I remember. And I think the point is so that you're just kind of feeling stronger, so that you have some energy there.
Vitamin C can drop your blood sugar too.
Yeah, and that too. Yeah. And it doesn't drop it severely, but it could if someone has a predisposition to hypoglycemia. Yeah. Susanna had a good question on how IV therapy is used for asthma. Do you want to comment on that a little bit?
So yeah, IV therapy, we have, before I started, I think we had an asthma protocol. We don't really call it that anymore.
Yeah, we don't call it that, but yeah, there is an asthma
protocol. So it might be something that we actually create another asthma protocol.
We're constantly doing more of these protocols.
Yeah, but magnesium, usually an asthma protocol would incorporate magnesium, probably glutathione, as well as all the other nutrients, but it's usually a higher dose of magnesium.
So what's happening in asthma is that the upper airways, especially the bronchial tubes, are constricting. So there's this bronchoconstriction. That's why we don't want to take people off their meds for that. I think these meds can be very life-saving, albuterol, different inhaled steroids if they need to, but all these things are helping reduce inflammation and help with bronchodilation, basically opening up the airways. And so magnesium, we know, is a bronchodilator. It helps to relax smooth muscle. It helps improve